Good morning.
Good morning, Rickey, Smiley, and how are you today, sir?
Man, I'm blessed this morning, man. Happy to have you this morning. I know you got a lot of stuff.
Well, yeah, let me tell you, Rickey, the news is not good in reference to the coronavirus. The United States is now averaging over 100,000 new COVID cases each day. And this is thought to be a direct result of the millions of Americans that traveled 2 weeks ago for the Thanksgiving holidays. So we're right at the point where transmissibility would convert to disease state, and so people are being detected. So 121,000 as of Saturday per day, according to Johns Hopkins University, but that's not the bad part. That's bad enough. But now the 7-day average for people dying is 1,651. So, now people are catching it again, 1,651 people dying. Remember, people, this is still out there. It's still real. We still need to get, the number one way to prevent this, get your vaccine. Number two, mask wearing and social distancing. So people have relaxed. When you see large crowds at things like the Georgia-Alabama game, you don't see any mask in the crowd. People are just gathering.
Right.
And then we're seeing as a consequence, 2 weeks later, cases being everywhere. So there are multiple cases, of course, of the Omicron variant now in 16 states, those states being Colorado, Connecticut, Hawaii, Louisiana, Maryland, Massachusetts, Minnesota, Missouri, Nebraska, New Jersey, New York, Pennsylvania, Utah, Washington, and Wisconsin. Also, Hawaii. So, all across the United States now, the Omicron is showing and rearing its nasty head, but it's not really shown to be, it's passing around easily. It's easily spread, but the virulence doesn't seem to be high at all. We're still dominated by the Delta variant, and that's the one we have to keep our eye on. Over 90% of cases are still Delta, and so we have to protect ourselves from that with Christmas coming up.
All right, John, with Dr. Collier. Good morning.
Good morning, Dr. Collier, Rickey, Smiley, and crew. I'm calling from St. Louis. Before the first COVID came out, I was hospitalized for 3 days for what they said was a rhinovirus. I had the exact same symptoms as the symptoms that they said COVID had. And everybody that came to see me had to wear a mask. And I was just wondering if it was possible that I've already had COVID, although I have had 2 shots.
Yes, it is possible that you probably did have COVID. We just didn't know what to call it. It is a rhinovirus, which is the same class of viruses that the common cold are, but just a little slightly different presentation. But now that you've had shots, an antibody test is not going to answer that question. So based on your medical history alone, a good analysis would show that it probably was a COVID infection, but you've done the right thing. If you had COVID, you recovered from it, and you've had 2 shots, you are now an immunological super soldier. You have the highest level of protection that you can get. So that's what I recommend for anybody. Get your vaccines.
All right, Dr. Collier, let everybody know how you can be reached.
Okay, you can reach me on all social media at ASK Dr. MJ, and these are the opinions of Dr. MJ Collier, not those of Rickey Smiley, the Rickey Smiley Morning Show cast, or its production crew.